What are minority health disparities? My name is Dr. Erica Steele. I'm a holistic doctor in family practice. I hold 6 degrees in my field, and they're all in the natural healthcare space, and I went to school, so you don't have to. So what are minority health disparities? That's in reference to the differences in health outcomes between minorities as well as non-minorities. These disparities are often related to social, economic, and environmental factors. And by addressing these factors and promoting health equity, we can work towards eliminating these health disparities and ensuring that everyone has equal access to quality healthcare services. Minority health disparities refer to these differences, and they are vast. There's so many different differences that we really don't think about, and we'll talk about some of those studies that actually prove this, because I think a lot of people want to not pay attention to the higher rates of chronic disease, the lower life expectancy, or the higher infant mortality rates among minorities because maybe it doesn't affect them. But these health disparities are often related to so many different social, economic, and environmental factors. For instance, poverty, limited access to healthcare services, discrimination, and language barriers can contribute to these health disparities among minorities. Additionally, environmental factors such as pollution, access to healthy foods like food deserts can also contribute to health disparities. Some of the studies that prove this were the COVID-19 disparities. A study by the Kaiser Family Foundation found that COVID-19 had disproportionately affected people of color with higher rates of infection, hospitalization, and deaths compared to their white counterparts. Maternal health disparities was another study done by the CDC that studied Black and Native American women that were 2 to 3 times more likely to die from pregnancy-related causes than their white counterparts. Mental health disparities was another study done by the National Alliance on Mental Illness, found that Black and Hispanic individuals are less likely to receive mental health treatment than white counterparts. Again, maybe that's taboo, maybe that's because the cultures don't tend to recognize mental health. Chronic disease disparities also existed. The American Diabetes Association reported that diabetes rates were highest among Hispanic and Latino as well as Black individuals. Also, there was a study that was reported by the Commonwealth Fund of Access to Healthcare that 30% of uninsured adults in the U.S. are people of color. Again, provider diversity, which definitely can help with equitable care. The Association for American Medical Colleges reported Black and Hispanic individuals account for only 10% of physicians and 5% of dentists in the U.S. And then let's talk about the LGBTQ plus communities. A study by the National Institute of Health found that LGBTQ plus individuals face significant health disparities, including higher rates of mental health disorders and greater difficulty in accessing healthcare. So those are just some of the studies that have been done on health disparities and the significant impacts on the well-being of those individuals in those communities. So which can result in reduced quality of life, increased healthcare costs, and decreased productivity. Those are some of the different impacts. Moreover, health disparities can perpetuate cycles of poverty and inequality generation after generation as access continues to go down. So how do we address these healthcare disparities? Initiatives such as increasing access to healthcare services, addressing social determinants of health, and promoting diversity and inclusion in healthcare, as well as addressing systemic racism and discrimination, really need to be implemented. And as we work towards eliminating health disparities and promoting health equity, we can improve the health outcomes of everyone. It's really important that we see this as an issue, that we come out of hiding, and just because it doesn't affect you and maybe your community or your population doesn't mean that these things don't exist. These health disparities are often related to social, economic, environmental factors, and they really affect the entire population. With rising healthcare costs, it can really affect everybody's healthcare well-being. Even if you think it doesn't affect you, in turn, it's going to affect you in some way. Working towards eliminating these health disparities, we can improve the health and well-being of everyone. So I think it's very important to, number one, build awareness, begin to understand what these minority health disparities are, and then we can really go to work in terms of what can be done to ensure that we close the gap and that everyone has equal access to healthcare. I know in my practice, we have done that through a lot of our education standards. We also do that with a lot of our public health outreach outreach. I know during the pandemic, I did lots and lots of education, both on Clubhouse as well as traveling around the country and going into these populations that otherwise wouldn't be trusting in the traditional allopathic medical model, to really be able to help empower people so that they understand proactively what they could do. I also participated in a lot of education on television as well as online to really help to motivate people and empower people. It's important that we don't feel helpless, like we're not helpless and powerless and hopeless. Unfortunately, some of these communities really believe that. And so I think if we all come together and we all rally around and we all encourage each other, I think that can really help resolve these minority health disparities and bring quality, equitable healthcare to all.